Hi, I'm Danielle, and today I'm going to be talking about my experiences as a postdoctoral researcher. I'm going to talk about what I did before my PhD, what I did my PhD in, and what I've done since. I'm also going to talk about some of the decisions I've made along the way, and hopefully finish with some advice for anyone who's thinking about what to do next. So this is me, and as I said, I'll talk about what I did before my PhD. I'll then talk a bit about my PhD, what the topic was, and what sort of decisions I made whilst I was doing it, what I went on to do afterwards, and then some advice, things I wish I'd known, or maybe things I would have done in a different order. I did my undergraduate degree in mathematics at Keele University. It's quite a theoretical course, but I really enjoyed the statistics modules I took. The career options that were given to me whilst I was studying in Keele were you could maybe do teaching or accounting. And I knew I didn't really want to do either of those, so I thought I'd better find something else I could do. So in the summer of my second year, I applied for an internship with Arthritis Research UK. They were based at the medical school on campus, and that's how I heard about it. And so I spent 3 months working with them, learning about how to do medical research, some of the stats involved, working with data, and got to do my own research project. I really enjoyed my time there and loved it so much that in my final year I went back to do my dissertation using some of the data sets I'd worked with before on my internship. So that really cemented for me that I wanted to do medical statistics, and that was the career route I wanted to pursue. So I went on and did a master's in biometry at the University of Reading. Biometry, people always ask, unless you know someone who's done it, people wonder what it is. It's the application of statistics to biological sciences. So whilst a lot of it was quite theory driven, some of the modules related to ecology, but some of them more in like clinical trials, which is the bit I was interested in. And when I finished that, I applied for a job as a medical statistician at the Clinical Trials Evaluation Unit in Bristol. And that was my first real experience of working with data sets and actually conducting research, analysing trials, but also working with a full team, so trial managers, trial coordinators, database team. And I really enjoyed my time in Bristol. I think I was there for 2 years, and then I realised that to progress, I would probably need to start looking at a PhD. And whilst I was sad to leave, I wouldn't have gone on to do it without having worked there first. So I applied to do a PhD, or a DPhil as it was in Oxford. I applied through the MRC-NIHR-TMRP funding stream, which is now rebranded but does still exist. And then when I was successful, I applied to Oxford, and I worked at the Nuffield Department of Population Health with my supervisors who were Mike Lay, Jane Armitage, Martin Landry, and Rory Collins. We were up in Headington, so we didn't get to work next to the RAGCAM. This was not the view we had, unfortunately. But my research was in how we could use routine data to recruit and follow up patients in large clinical trials, and sort of really exploring this idea of trial efficiency and how we can use existing data to make trials more efficient. Overall, it took me about 3.5 years to finish my PhD. So whilst I was there, I had some great experiences and opportunities. I got to work with large trials and data sets. So the trial I used for my thesis had 20,000 randomized patients, which is 100 times bigger than anything I'd worked on before. And so I got to learn about some of the logistics and practicalities and analysis issues with that. I also got to work with a large team of the clinicians, the programmers, the data managers, the research nurses, everyone who works to make these large trials, these mega trials work, and understanding the logistics of that as well. And that was really interesting, seeing how you can run everything from just one site. I also got to learn how to develop my own ideas and research, and became quite self-sufficient and more confident in my ideas. Then the joys of being a student came to an end, and I had to go and find a job. And I actually started working at Imperial before I finished my writing up my thesis, which I would not necessarily recommend unless you have incredibly supportive managers who will allow you the time to finish that whilst working full time. So I moved to the National Heart and Lung Institute in London and started my postdoc working on cystic fibrosis. So I worked in a group called CF EpiNet, which was a collaborative group across 6 universities based in the UK and in Canada, all trying to improve research in cystic fibrosis by using registry data. So rather than going into trials, I took the large data sets and data linkage that I'd used in my PhD and took that forward into sort of a more epidemiological data set. We were hoping to do some linkage with HES data, but I only had an 18-month contract, and the delays from NHS Digital unfortunately meant we never got to access that data whilst I was still there. But I did get to do my own research using the registry data in a couple of different areas. I was able to attend and present at multiple conferences, both in the UK and abroad. And I think for me, working in the largest multidisciplinary team I ever have before, so cystic fibrosis by the nature of it has so many clinicians, dietitians, psychologists, many other teams all coming together and working. And when they all want you to do research and they all want their input included, it really helped me work out how to manage working with such a large team with such differing views. And once my 18-month contract had come to an end, it was time to find a new job again. And so I applied for a job at King's College London, based in the Institute of Psychiatry, Psychology and Neuroscience. So I'm working with a team of statisticians. I'm working underneath Richard Emsley, and we're doing a lot of clinical trial methodology work. By nature of the department we're in, it's all sorts of within mental health research and the trials we work on within that. But I've also had the chance to work on some fatigue and long COVID stuff as well. I think the thing I've learned most from being at King's is working directly with statisticians again, rather than being the sole statistician working with a team of clinicians, is that I'm realising how much more there is to learn and how easy it is to learn when there's other statisticians all around you. So learning new statistical methods and analysis techniques and even coding, that's been really useful for me, even though I started the job in April last year. So I've been doing it remotely for 18 months and hadn't really met anyone. It was still having the knowledge around you that I found really helpful. And that's where I am now. That's what I'm doing. I'm hoping to stay and continue my research and hopefully look at putting together a fellowship application of my own in the next couple of years. My experiences have been quite broad and wide-ranging, both in terms of the areas of medicines I've worked in. So, as I said, surgical trials, bariatric trials. My PhD was in cardiovascular disease. I then got to work in cystic fibrosis, and now in mental health. And for me, it's really exciting to be able to take my skills as a statistician and bounce around those different topics and learn a little bit, sometimes quite a lot, about those areas of medicine and the research being done in them. I also know people, though, who stick to one area. So they do cardiovascular disease and they're a statistician in cardiovascular disease, and that's what their research interest is. And there's nothing wrong with that either. I just think for me, being quite junior in my career and still working through, it was interesting for me to learn about the different applications in different areas. And then again, the different areas of methodology, so working with routine data and data linkage, working with large data sets, going back to my PhD and using these things to try and improve trial efficiency, something I'd like to take forwards more now. But also learning things about like moderation and mediation analyses and personalised treatment recommendations. So a whole different area of methodology as well. Again, some people might particularly want to work in one thing and become an expert in it. But for me at the moment, I'm enjoying learning a little bit about everything and then taking those 2 or 3 or 5 points there and really diving deeper into those. So what advice do I have? What do I wish I'd known? What would I do differently? The route I took, I think by definition of where I took the jobs and did my PhD, is that after I left Bristol, I was working with clinicians rather than statisticians and was quite often the only statistician or one of two who were working in a room together in a department. And I think if I got to do it all again, I would potentially look at working with more statisticians earlier on so that I could learn the knowledge I'm learning now and then take that forward to apply to the different areas of medicine and research. It's not massively impacted me. I just think if I got to do it again, that might be a nicer way around to do it. Networking, everyone says it, but it's really helpful to meet people and hear about job opportunities and funding opportunities as well. So the more people you speak to, the more people you know and recognise the next time you go to a conference or a meeting, who might be able to put you in touch with someone who knows something useful. And finally, making use of the opportunities provided whilst you're studying. So career days at different departments and universities. I attended careers days in Oxford and at Imperial and at King's. I think there's no harm in hearing about all the different opportunities and differing views on it from different career departments. And they're normally free and they're really helpful to attend. And events like today, so learning what opportunities are out there, what routes other people have taken, whether that's academic or in industry, and learning what opportunities there might be. And if I hadn't heard about the statistical internship, I'd probably be a teacher or an accountant. So the more things you attend, the more you hear about, and hopefully get to follow into something you really love. That's a brief summary of what I've done, what I'm doing, and some of the decisions I made along the way. So we'll be around for the Q&A session after all the talks are finished, but my details are on the screen. If you have any questions or want to get in touch, please feel free to do so. Thank you very much.